Good morning. You're watching Fox 46. Good day, Charlotte.
Coronavirus almost certainly will spread at some point in the United States to some extent. Hospitals, businesses, and schools all making preparations. That is the warning from the CDC that they should do that. But what is coronavirus exactly? People asking, is it the next Black Plague? Should we buy face masks? Will any of that help? Do we need it? Here today to answer some of those questions and separate fact from fiction, Dr. Anna Maria Temple, pediatrician with Integrative Health Carolinas. And you call this an infovirus, right?
Infodemic.
Infodemic, excuse me. So because we have so much information, but not really enough of the important information going along with coronavirus, let's start with what is it in the first place and go with layman's terms here.
Got it. Coronavirus has been around in the United States and worldwide since 1960. This is a novel strain. The reason it's spreading is because it's new, and so most of our bodies haven't seen it. Therefore, we don't have antibodies to it. But it has been around for a long time, so you can go to the hospital, get a swab, and it says coronavirus, and everybody's like, "Whoa!" It is a very specific strand. We know about SARS that was several years ago. That was a coronavirus as well, and it was new. It mutated. The humans didn't have antibodies, and it caused problems.
You mentioned SARS. People familiar with that from headlines from years ago. The flu is what this is being compared to many times. So people are used to hearing headlines about the flu. When you compare death rates with the flu and with coronavirus, with this strand that we're talking about now that we're seeing, make that comparison for us in terms of how worried people should be, how dangerous it is.
Well, you know, 80% of the coronavirus infection is mild. 80%. And a lot of people are now reporting the mild cases. So in China, the death is like about 2%, but that's probably elevated because we are not hearing about people that have mild disease. And the flu is going to be like 0.5%. When I looked at the numbers across the world, in China, right now it's a 2% fatality rate. In Italy, it was 0.3%. So it also depends on what country, what the background is, who's getting infected. It's much more complicated.
Because you were also saying the people who have died from coronavirus, the ages and their overall general health is very significant in terms of who it's been fatal for too.
Totally. So as a fact that nobody knows is that there's been no reported deaths among all the deaths that are posted out there. There's no deaths for children between 0 and 9 years old, 0. And pregnant women, 0. And this is coming out of China. It's not even like all in the other countries, which is really important to know. Most affected people are going to be elderly, especially over the age of 80, and if you have cardiac disease, any cardiac issues.
So what I'm hearing you say is that people are kind of freaking out over, maybe they shouldn't be freaking out as much as they are, right? And there's sort of an appropriate level of concern and prevention here. There are people, though, who are going to hear this and regardless want to be sure that they are taking whatever reasonable steps necessary to prevent it and keep themselves and each other safe. What do you think is reasonable to do at this point?
Right, and I think we should be aware that it's spreading. Absolutely. I'm just saying the level of hysteria is a little much. In the U.S., we only have 60 cases and no fatalities, but we need to be prepared. The number one thing is if you have fever and a cough, don't go to work. Don't send your children to school after you give them some Tylenol, because I know there are deadlines and tests need to be taken, but we are responsible for preventing the spread of disease. Number two, we got to wash our hands. The most important way to prevent spread of this or the flu is hand washing with soap and water. And then the third, everyone is running out to buy masks. How about we buy vegetables? I mean, that is what is going to work on our immune system, is buying vegetables, right? Everybody's like, we're going to be quarantined and we should stock up on. How about we stop eating sugar? I don't know that anybody's listening to me, but I'm going to have a tantrum right here on the studio very soon. Stop eating so much sugar. That prevents your immune system from working against this virus. You know, we're all looking, what's the latest? Oh, let's shave our beard. Okay, stop eating fast food and start eating more whole foods. Like that's, I think the thing coming from the CDC is like, everyone buckle down, shave your beard, get masks. I'm like, get vegetables, stop drinking juice, stop drinking soda.
There's natural ways that you can help to boost your body's own ability to fight something like this off.
Correct, the body knows how to do it, and since 80% of it is mild symptoms, we're able to fight it, but we're in this hysteria that we're like, oh, what is the quick fix? What's the latest gadget I can buy? Celery is the latest gadget.
Dr. Anna Maria Temple, I wish that we could get you to come out of your shell next time you come on. Thank you for the common sense advice here this morning. Jason Harper is so happy to hear you can keep your beard, Jace.
Oh, beard and vegetables. Now I'm spraying my hands.
There,
okay.
yeah,
That's
and
it.
that.
Keep the beard, buy more vegetables, less sugar. Got it.